Kind enough to join us this morning. It's Wednesday morning. He's part of this show for over 30 years. My good friend, Dr. Joe Congedi, Sports Medicine Center, Akron Children's Hospital, on board with us live this morning. Joe, what do you have for us today?
Hey, Ray, how you doing this sunny morning?
I know. I'm ready for it after yesterday, that's for sure.
Yeah, oh my gosh, have we had some weird weather in the last week. But there's some weird things in sports medicine, too, and I just want to touch on it from my standpoint, mainly, as you know, throughout my career, mainly high school, some college that we've taken care of, and college athletes we've taken care of. But what really kicked up a firestorm in the last week that I want to just give a little bit of my opinion on is the issue with second opinions and making decisions about people playing and returning to play. And we're getting through that season of the year where there was a lot of that. A lot of that in professional football, revolves around the combine, where people are trying to make decisions about trades and people getting paid and how much and how many years. But it happens now a lot in college during that NIL period where there's a lot of teams that want to sign college players. And now we know there's high school NIL on the horizon. So this may be more of an issue for even a lot of my younger colleagues as we get further along. But sometimes it is hard to make those decisions. And I have no problem at all with second opinions in sports medicine. These kinds of decisions can be complex. A lot of times it's not necessarily the injury that's that complex or different, but it's kind of how it's going to affect the athlete. And so it's a little bit different than, okay, another 25-year-old or 30-year-old walks in your office and has an injury. Okay, what do we have to do to get this person better from this knee problem or this ankle problem? And in these situations, there's a lot more that goes into it. So, of course, there's trades, there's signings, there's schedule changes, there's how many years are you going to sign people to and everything. And so in the last week, what really was maybe one of the more controversial, although every year at this time there's controversy, was a trade with the all-pro defensive end Max Crosby. He had a relatively common injury. You and I have talked many times about meniscal tears, meniscal repairs, injuries to that cartilage in the knee known as the meniscus. And but it is different in different people, and so there's going to be different opinions on this thing. But a very significant trade fell through with Max Crosby. It was a big deal with a lot of draft picks, and it would have had a big effect on the Raiders and the Ravens. And he even, flew to Baltimore to be a part of the team, and both teams in the Raiders particularly said, hey, they were starting to plan with life without him and who they were going to draft and all this for a few days. And then he was seen, and the report came out that he failed his physical exam, and they were not going to accept having him, and they rescinded the trade. And there was a lot of discussion and controversy, especially toward the Baltimore front office, with accusations flying around that they knew some of this, they wanted to get out of the deal. These kinds of things happen a little bit every year. With a lot of the criticism, hey, gosh, the Raiders had already moved forward and everything. There was, to a lesser situation, an issue with the Browns, with a lineman from the Packers, Elton Jenkins. It looked like it was going to maybe be a trade situation. It ends up being a signing. But these issues affect how much do you sign people for money-wise? How many years do you sign them for? How are these injuries going to affect these things? So what really is different even though these two injuries were not that complex, Jenkins had a high sprain, torn ligament, and a fracture, but as he was looked at, the Packers looked at him and said, no, they didn't like where he was situation-wise, and they just said they weren't going to re-sign him because of the injury also. So a couple things that I would suggest that people kind of look at with this thing that make it so complex and difficult. And so for my brethren in sports medicine, this is particularly the surgeons, because a lot of these cases are surgical. Number one is the time issue is so difficult because they have such a short period of time. There may be 2, 3, 5 teams that want to make decisions and take a look at these athletes over a very short period of time. So the sports medicine team really is back against the wall and trying to make these decisions time-wise. The other thing is we're looking at performance. Short-term prognosis. Are they going to be 70%? Are they going to be 90%? What are these athletes going to look like when they switch teams? And, man, you're almost looking at these medical teams to be mind readers in some of these very difficult cases. And then the third one, of course, is long-term prognosis. Is this going to shorten their career? Are they going to have a rapid decline and a significant diminishing of skills as they move on to another team? Again, this plays a role now in college too, and we even see it in high school injuries, of course. So there's a lot of gamesmanship that goes on. There's a lot of accusations flying back and forth. There's a lot of pressure on the medical team. I'm going to just say here, as I give my way of looking at this, I'm going to give sports medicine teams the benefit of the doubt. Oh, what a surprise. I've been in this field so long. Typically, I don't think they're trying to mislead people purposely or not be honest about these things or trying to deceive people. But you just can look at these things in a lot of different ways. So I would, as a non-surgeon, when we as a medical team look at somebody who's going to change teams and other things, number one, if there was a surgery involved, I really trust the orthopedic surgeon who did the surgery the most. They were in there. They've been with this case from the beginning. They saw the pathology to some extent. And so I always kind of give the benefit of the doubt when I'm asked for opinions on these types of situations. I look at that as being an important part of it. Secondly, you and I talk about this so many weeks and months of the year, other injuries that can affect what's going on with this athlete and can make this more of a cumulative downhill effect where these athletes are going to really struggle to be, to get to their full potential, and there may be a diminution of skills overall. And thirdly, really important is a lot of people on the coaching staff, but also the medical staff, they know the psychological makeup of the players. Is changing teams for these athletes going to be changing locker rooms? Is it going to be a real strong positive for these athletes, or is it going to be a negative? How really invested are they in continuing on in the future? Because for a lot of these things, all these surgeries and other things are really difficult to live through as an athlete. So those are the three things that I really take into account if somebody asks about second opinions. And I don't think there's anything wrong. In fact, I think in these complex situations, as I laid out, all those hard things you have to do with timing and prognosis, short and long term, I think it's not unreasonable to get second opinions in a lot of situations. And I'm going to give the benefit of the doubt that most of the people I've come across in a 40-year career in sports medicine are not trying to deceive people, and they're trying to do the best for the athlete they can.
You know, what's interesting about that Max Crosby situation that you were alluding to is that the Ravens brought in other doctors, including a well-renowned doctor from the Dallas Cowboys that looked at Max Crosby's knee as well, and also kind of with a long-term prognosis, Joe, gave it a thumbs down. And if you notice, Crosby was sent back to the Raiders, and no one else has jumped in, at least on a trade. And the Cowboys issued a statement saying that they would not pursue Max Crosby when they were rumored of being in the fight to get him. So that kind of tells you something, and it also tells you the value of other doctors coming in with the same conclusion.
There's no doubt about it. I mean, look at this, 32 people sitting in Indianapolis at a combine, and their medical teams could have, multiple different opinions of what's going on. And, I read some of the guidelines of how his surgeon felt so strongly about how well he was improving from this meniscal injury. But another thing that's working against him that you and I talk about is, been injured in the past, getting a little bit further along in his career. Man, when you get to that level, I'm so lucky with the high school kids is typically they don't have that long litany and list of other injuries that can affect this thing. And you and I know there's other things and other factors that play a role. And that may be, just looking at it from the outside, part of what's making people stay off of Max Crosby.
Yeah, and years ago they would have still done it, but now the money is so high stakes that to take all that money invested into a guy with multiple question marks, you can see why the Ravens said no and nobody else has said yes across the NFL. Joe, great piece this morning. Good insight, good intel into the world of second opinions. Thanks again, my friend. Always appreciate the time.
Thanks, Ray. Enjoy the rest of this week.
You too, my friend. Dr. Joe Congini. Dr. Joe joined us on Sports Medicine. He's been part of this morning show for over 30 years, and he has a date with us as long as he has time for us. Great information